So now let's just briefly look at some of the different ways that ultrafiltration can be affected when there are changes to these main Starling forces. This first image shows an example of a normal capillary bed. Hydrostatic pressure is here in green, and on the arteriolar side it's high, but as blood flows across the capillary, the hydrostatic pressure decreases because of the resistance. Colloid osmotic pressure is in blue and it remains constant. So here in this normal example, we have about an even balance of filtration on the arteriolar end and absorption on the venous end. So this leads to very little net filtration, which the lymphatic system can handle. Now let's look at the effect of arteriolar dilation. So a couple of things that can lead to dilation of the arterioles would be decreased input to the sympathetic nervous system or the release of inflammatory factors like histamine, for example. And this dilation would cause increased hydrostatic pressure throughout the capillary, which would lead to an increase in filtration, which could cause edema. So here there's a higher initial capillary hydrostatic pressure because of this arteriolar dilation, and the resistance across the capillary hasn't changed. So there's still the same amount of hydrostatic pressure drop as blood flows across the capillary, which means that the hydrostatic pressure is also higher at the end here. So you can see that compared to the first example, which is in this dotted line, the hydrostatic pressure line is higher and it has the same slope. And because capillary hydrostatic pressure is the driving force for filtration, if it's higher at every point along the capillary, there'll be an increase in the capillary filtration rate. Now let's consider arteriolar constriction, which can occur when there's an increase in sympathetic input or an increase in particular hormones like angiotensin or vasopressin. And the arterial constriction causes the similar type of decrease in capillary hydrostatic pressure. So compared to the normal hydrostatic pressure in this dotted line, the capillary hydrostatic pressure with arteriolar constriction is lower at every point. And again, since capillary hydrostatic pressure is the driving force for filtration out of the capillary, lowering that pressure at every point along the capillary leads to decreased filtration and net absorption. Now let's look at changes in the venous end, and as we saw, increasing venous pressure has a relatively large effect and it increases filtration. So increasing the venous pressure decreases the gradient for pressure dissipation across the capillary. Some things that can lead to this increase in venous pressure are orthostatic stress, like prolonged standing, volume expansion, and remember that blood volume is mostly stored in veins, so increased blood volume would increase venous pressure, as well as heart failure and pregnancy. So increased venous pressure causes an increase in filtration because it increases the capillary hydrostatic pressure, leading to much more filtration than absorption, and that can lead to edema. Changes in colloid osmotic pressure also change filtration. So, for example, in a case of dehydration, there is a decrease in plasma volume. And because of this decreased plasma volume, there's actually an increase in the concentration of the plasma proteins, like albumin. So the number of plasma proteins hasn't changed, but now they're dissolved in less plasma. And therefore the plasma protein concentration has increased, and there's an increased colloid osmotic pressure. And that increase is shown here in blue compared to the normal colloid osmotic pressure in this dotted line below. So capillary colloid osmotic pressure opposes filtration, pulling fluid back into the capillary. So if we increase that force, there's now increased absorption. And that absorption is great in a case of dehydration because volume is being added back to the plasma from the interstitium, helping to maintain that mean arterial pressure. And finally, in some conditions, there are fewer plasma proteins. So this happens in liver disease and kidney disease and starvation, where there's a decreased concentration of plasma proteins. So this leads to a decreased capillary colloid osmotic pressure, denoted by this blue line here, which is lower compared to the dotted line of the normal capillary colloid osmotic pressure. So this decrease in a force that is pulling fluid back inside the capillary leads to an increase in filtration, which can lead to edema.